my name is Alexis, and I'm presenting my informative speech for this week. So I want to talk about how access to affordable and quality health care is a problem within our inner cities. So with the current health care reform that hasn't changed yet, the increased insurance coverage, residents in those underserved areas still have greater difficulty in receiving timely and appropriate clinical care. So I believe the reason for this is a shortage in primary care physicians, funding, and as well as education. So in an attempt to tackle this issue, it requires a firm approach to two key issues: accessibility to the care facilities as well as availability of those quality health care professionals. So in surrounding communities, there are a number of hospital facilities that are not always easily accessible in those communities, and a number of individuals that do not have the necessarily funds or a car to drive to get to those appointments. So federal program incentives have been created in some of these underserved hospitals to help pay back those loans to those providers that sign on as a sign-on bonus with them, but it's an increased amount. It's not like the regular for-profit organizations. So I believe with continued awareness and incentives, we can overturn this issue. So the government will save as well, because they're easily accessible, and those individuals won't be readily easily to go to the emergency room. They'll take advantage of those primary care appointments, which will help save the government, because as we know, the emergency room can be way more expensive than a simple primary care visit. So I currently work for a nonprofit organization called Care Alliance. Care Alliance is centered in an underserved community and caters to those with not many private patients, but more patients that receive Medicaid and Medicare. So to date, Care Alliance has seen 385,000 patients. They are set up under grant funding. So when it comes to education studies, documents that receive preventative care improves health outcome, and in turn lowers the probability of subsequent medical service utilization. So that grant funding will help put those facilities in those underserved communities to help education is very, very important with this, because it will teach them, because we don't always know if we're not in that professional environment in the healthcare profession what is considered an emergency and not an emergency. So again, when it comes to education, the utilization of primary and preventative care services reduces the probability of the utilization of inpatient services. So the likelihood of patients utilizing the preventative measures is more likely with the benefit of the facility within walking distance from their home. So patients will be less likely to utilize emergency room care as primary care measures, which is expensive again, and overuse of insurance. So if we continue to educate ourselves within and the community, we can continue to oversee the shortage of physicians, funding, and education to our patients. So this is an ongoing issue, and if many other organizations would see grant funding like Care Alliance Health Centers to help improve the quality of care of communities, we can help fix this issue. So thank you for listening. Bye.